Common signs and symptoms of GERD are upper abdominal pain as well as chest pain, backwash, also known as regurgitation of food or sour liquid, trouble swallowing, which is known as dysphagia, a burning sensation in your chest that usually follows eating, which is commonly referred to as heartburn, and the sensation of a lump in your throat. Some people with GERD experience increased acid reflux and heartburn at night or while they are laying down. Those who have nighttime acid reflux may experience further symptoms such as an ongoing cough, new or worsening asthma, and the inflammation of the vocal cords, which is known as laryngitis. Most people have the ability to manage the discomfort of GERD with lifestyle changes and medications, but even though rare, some may need the help of surgery to ease their symptoms. So you may be wondering when it is necessary to seek medical care, and if you are experiencing chest pain, shortness of breath, or jaw or arm pain, it is a reason to seek immediate medical care because it may be a sign of a heart attack. Even though GERD may not seem like an intense digestive disease, over time the chronic inflammation in your esophagus can have long-term complications. One of these complications is esophagitis. Esophagitis is the inflammation of the tissue in the esophagus. Esophagitis is when stomach acid breaks down tissue in the esophagus, which causes inflammation, bleeding, and sometimes an open sore or an ulcer. Esophagitis can cause pain and make swallowing difficult. Another long-term complication associated with GERD is the formation of an esophageal stricture. An esophageal stricture is the narrowing of the esophagus. Damage to lower esophagus from stomach acid causes scar tissue to form. The scar tissue narrows the food pathway, and this leads to problems with swallowing. The final complication that is caused by chronic inflammation of the esophagus is called Barrett's esophagus. Barrett's esophagus refers to the precancerous changes to the esophagus caused by acid damaging the tissue that lines the lower esophagus. These changes are associated with an increased risk of esophageal cancer. If you are struggling with GERD symptoms, you can manage your nutrition to avoid triggering further symptoms. Certain foods and drinks that have been linked to GERD symptoms include acidic foods like citrus fruits and tomatoes, alcoholic drinks, chocolate, caffeinated drinks like coffee, spicy foods, foods that are high in fat, and mint. If you're overweight or struggle with obesity, your doctor may suggest losing weight to reduce GERD symptoms. Doctors may also prescribe medications such as antacids, H2 blockers, and proton pump inhibitors, also known as PPIs.